Lindsay, what are you doing?
I'm fighting diabetes.
All right, this is a presentation on Ayurvedic medicine and the effects of cinnamon on blood glucose levels in the treatment of type 2 diabetes mellitus. My name is Brett Curtis.
I'm Lindsay Coleman. And I'm Renee Keith.
And this will be our examination of cinnamon on blood glucose levels. So, cinnamon is a treatment used in Ayurvedic medicine, and some background on Ayurveda. It is, by definition, the science of life, prevention, and longevity. Ayurveda has 8 divisions, including internal medicine, ophthalmology, and otorhinology for the head and neck, surgery, toxicology, psychiatry, pediatrics, prevention of disease and improving immunity, and the science of fertility. Some histories of the use of cinnamon in Ayurvedic medicine. It's been used in India for 5,000 years, and it's one of the oldest study of medicine in the world. Estimates of usage varies among race, ages, and geographic location. And it's also used to lower hemoglobin A1C in diabetes patients. Some of the chemistry of cinnamon, it's derived from cinnamonic aldehyde and activates NRF2-dependent antioxidant responses. This happens in the human epithelial colon cells. The genus of cinnamon is Cinnamomum, and the species is Cinnamomum verum. Also, the pathology of diabetes, there's type 1, where the pancreas lacks beta cell receptors to produce insulin, and type 2, insulin receptors are unresponsive to increased blood glucose levels. The mechanism for cinnamon that we've gathered from our studies include the phosphorylation of insulin receptors, which leads to increased insulin sensitivity and improved glucose and lipid levels. Some of the evidence analysis that we've acquired from our studies, this was a study entitled Cinnamon Improves Glucose and Lipids of People with Type 2 Diabetes, and it was a study done in Pakistan in the publication Diabetes Care Volume 26. Its purpose was to determine whether cinnamon improves blood glucose levels, triglycerides, total cholesterol, HDL cholesterol, and LDL cholesterol in type 2 diabetes.
So this particular study, there were 60 individuals, all with type 2 diabetes. This included 30 men and 30 women, all 40 years of age or greater than 40 years of age and are not on insulin therapy, nor were they taking any meds for any other health conditions, and all had a fasting blood glucose from 140 to 400 milligrams per deciliter. Compliance was monitored by capsule count and contact with subjects, and compliance was considered excellent and all capsules were consumed.
So this was a 60-day study, and the individuals in the group were randomly divided into 6 equal groups. Group 1 took 2 500 milligram capsules of cinnamon per day, 5 milligrams or 0.5 milligrams after lunch and 0.5 after dinner. Group 2 took 6 500 milligrams of cinnamon per day, which was divided up 1 gram after breakfast, lunch, and dinner. Group 3 took 12 500 milligram capsules of cinnamon per day, 2 grams after breakfast, lunch, and dinner. Groups 4, 5, and 6 received placebo groups of wheat flour.
So the results of this study, after 40 days, all 3 levels of cinnamon reduced the mean fasting serum glucose between 18 and 29%, triglycerides 23 to 30%, LDL cholesterol from 7 to 27%, and total cholesterol from 12 to 26%. No significant changes were noted in the placebo groups, and changes in HDL cholesterol were not significant. These data values between groups and the duration of intake are significantly different with a p-value less than p05 or 0.05.
So another one of the articles that we evaluated was called The Effects of a Cinnamon Extract on Plasma Glucose, Hemoglobin A1C, and Serum Lipids in Diabetes Mellitus Type 2. The following are the authors that were listed, and the journal was the European Journal of Clinical Investigation, which was published in 2006. So the study group for this article originally consisted of 79 patients that were diagnosed with type 2 diabetes. It turned out that only 64 subjects were evaluated because 2 were excluded due to weight changes of greater than 5%, and 12 were excluded due to withdrawal of consent, serious disease, or irregular intake. These patients were not on insulin therapy but were treated with oral antidiabetics or diet. The study design consisted of randomly assigned subjects that were assigned to take a cinnamon extract or a placebo capsule 3 times a day for 4 months. This capsule was an aqueous cinnamon extract that corresponded to about 3 grams of cinnamon powder per day. One capsule contained 112 milligrams of aqueous cinnamon extract TC112. Placebo capsules looked identical but contained only crystalline cellulose, and these patients were instructed to take the capsules with a meal. Some of the statistics are that p-values less than 0.05 were considered statistically significant. Fasting plasma glucose concentrations at baseline showed correlation with decrease of fasting plasma glucose at R equal to 0.685 and p-value less than 0.001. The mean percentage difference from the individual glucose concentrations was 10.3 plus or minus 13.2% in the cinnamon group and 3.37 plus or minus 14.2% in the placebo group at p equals to 0.046. And there was an observed 10% reduction of fasting plasma glucose in the cinnamon group. No adverse effects had been reported.
So the next study that we looked at involved a group of scientists who studied the effects of a 1 gram cinnamon supplement in adolescent diabetic patients. The subjects had type 1 diabetes, and they were split into 2 groups. One of them took the 1 gram of cinnamon for 90 days, and the other group took a placebo for 90 days as well. And at the end of the study, the patient's A1C was taken. And the hemoglobin A1C is an important marker, biomarker for diabetes, because high amounts of hemoglobin A1C increase the risk of cardiovascular disease and kidney disease. So it's a valuable marker for overall health as well as quality of diabetes control. So after 90 days, neither of the groups had a significant difference in their hemoglobin A1C. Both of the groups actually slightly increased, so it didn't look like the cinnamon tablets had any sort of effects on the blood plasma glucose. Can we stop?
Yeah.
The study had a good quality. The scientists made a smart decision in choosing to study hemoglobin A1C, and a little bit about the background science behind that. Once a red blood cell interacts with glucose, it remains glycated, and the lifespan of a red blood cell is 120 days. So one of the concerns about the study was that about 25% of the red blood cells were potentially glycated before the 90-day study began, so the cinnamon wouldn't have been able to affect 25% of the blood cells that they were measuring. Another problem with the study is that physiological changes associated with puberty and psychological factors may have played a role in increasing the hemoglobin A1C levels in the adolescents that were studied. These factors may have overpowered the effectiveness of the cinnamon supplements. So that's another concern because the results of the study may not apply to all diabetic patients then. And another problem sort of with the study is that it was the only study that we could find that looked at type 1 diabetic patients. And there was only 57 patients who were involved in the study. Now, the clinical impact of the study. The study demonstrated that the use of cinnamon supplements does not benefit adolescents with type 1 diabetes, especially if used for only 90 days. The results would have been more compelling if the supplements had been consumed for at least 120 days due to the lifespan of the cells being analyzed. The generalizability was a little weak because the study only recruited adolescent participants whose A1C values are influenced by factors that do not apply as strongly to other age groups. The outcome may have been different for type 2 diabetic patients as well if cinnamon's mechanism of action increases endogenous insulin production, which does not happen in type 1 diabetic patients. Overall, the study had a strong design with minor methodological concerns that limited its generalizability among diabetic patients. Grade of evidence. Two of the studies were grade A individual randomized controlled trials, and the other study was grade A group randomized controlled trial.
So our public health recommendation is that we do not recommend cinnamon as an herbal supplement to lower blood glucose levels in patients with diabetes. Contraindications of taking cinnamon include possible allergies, including dermatitis, stomatitis, or skin rashes. There were no drug-nutrient interaction or side effects reported. Limitations in the data supporting use of the substance include that the reason that the supporting data focuses mainly on short-term blood glucose levels and not on hemoglobin A1C, which is actually a better indicator of efficacy of cinnamon. Recent pronouncements from federal regulatory agencies include the American Diabetes Association, which says that cinnamon has no benefit for people with diabetes. So for our overall level of evidence for all of our studies, we graded it as level 2 fair, and our justification for this was that there were inadequate population sizes that ranged from 7 to 109. There was also some doubt about the statistical or clinical significance of the effect. There was inconsistency amongst the studies, even though they were of strong design. And the studies of strong design for a question had minor methodological concerns.